Welcome to the October edition of Sex Talk, brought to you by Student Health and Counseling at UCSF. This is the online program that answers all your questions about sex.
Hi, this is Lisa DeGiorgio-Haig, nurse practitioner here at UCSF Student Health and Counseling Services. We do answer your questions, and you can submit them anonymously online at our website. This month, we have two related questions. I'm going to do my best to answer them.
So, these two related questions are as follows. Hi, I have been with my partner for 3 years and we have a healthy sex life. However, I've never been able to have an orgasm. We have tried everything from additional lubrication, clitoral stimulation, G-spot stimulation, longer foreplay, and changing positions. What can I do? And the related question is, as a woman, it's very difficult for me to orgasm, and I'm not sure if I ever had one. I grew up in a very conservative society that demonized sex and attached negative connotations to it, in part to prevent young women from premarital sex. I'm afraid this may have subconsciously affected my ability to enjoy sex and achieve an orgasm. Do you come across other women like me, and what's your advice?
So these are big topics, and they're not uncommon questions, and you are not out there by yourself having this experience. I think we need a little background for this edition of Sex Talk. I'd like to first review male and female sexual arousal. Now, this might seem a long way around this answer. Stick with me. I think you'll get the information you need by the end. I see both men and women in my practice, and most men tell me that anything can turn them on, but what they don't always realize is that sexual arousal works differently for women. Sex researchers Masters and Johnson back in the day were the first to outline the 4 stages of sexual response in human beings, which include excitement, plateau, orgasm, and resolution. And although men and women go through these same 4 phases, their journeys can vary in time and physicality, motivation, lots of different factors. So let's first talk about the guys. If you're a man who has sex with women, I think it's really important, or a man who has sex with men, it's really important to understand the stages of male sexual arousal. And if you're a man who has sex with women, understanding yourself can help you better understand your partner. A lot of men think orgasm is simply a matter of getting aroused and getting off, but there's a lot more to it than that. So let's talk about excitement. The physical signs of male sexual arousal are easy to spot. The testes begin to elevate, the skin around the scrotum becomes thicker, and the penis becomes increasingly erect. If you don't proceed to stage 2, excitement will pass fairly quickly. Plateau is stage 2, and at this point, the testes are fully engorged and reach their highest point of elevation. The penis's corona becomes engorged with blood and seminal fluid, which aids in lubrication, and that begins to secrete through the tip of the penis. There's often sperm in that lubricating fluid, and that's why it's not a good idea to put your penis inside a woman before you ejaculate and then pull out and put a condom on, because there's actually some sperm in this lubricating fluid that can cause someone to get pregnant. Anyway, at this stage, the desire for sex becomes very strong, and if you aren't able to move to stage 3, things can become painful. Stage 3 is orgasm. The fluids from different parts of the reproductive organs collect at the end of the urethra, creating a feeling of heaviness that men recognize as the signal of imminent orgasm. And then they experience contractions that they associate with climaxing. It is possible to hold back from completing this stage so you can continue to sexually stimulate your partner, but only for a short time. Stage 4 is resolution. During this stage, the penis goes back to non-erect size, and you might want to order a pizza. That was just a little joke to make sure you're listening. Men also have what is known as a refractory period, which interestingly enough, women don't really seem to have. But in men, that means that for a certain period of time, they are not able to achieve another erection. And that period of time varies from as little as 2 minutes to, 24 hours or longer. Okay, now let's talk about women. Keep in mind that although some women go through these 4 stages very quickly, most require more time than men before they can move to the next stage. During excitement, her nipples become erect, her vagina starts becoming lubricated, her clitoris begins to swell and grow larger, and the inner walls of her vagina begin to expand. Her breasts may even increase in size if she becomes highly aroused. As these are all physical cues, it's important to pay attention to your partner's body language too. If she's touching you or kissing you, she's probably excited. Second stage plateau, her heartbeat speeds up, her breasts may increase notably in size, her vagina swells, her vaginal opening begins to narrow, her clitoris becomes more erect, and the color of her labia darken. Only near the end of this stage will her body be ready for vaginal intercourse. Not all women experience this stage of arousal, which is why it's important to give her plenty of foreplay. Stage 3 is orgasm. Tense muscle contractions through the pelvic area will occur during orgasm, and a woman can have 3 to 15 of these contractions depending on the strength of her climax. She may also experience muscle contractions in other parts of the body as well. Most women's bodies become temporarily rigid at the highest point of their orgasm. Resolution: if a woman has achieved orgasm, she may be able to have multiple orgasms during the resolution stage. Otherwise, her body will return to normal, but at a slower rate than if she had climaxed. During resolution, her breasts and nipples can become very sensitive, so don't touch them too aggressively. Now that you understand the physical stages of sexual arousal in women, you'll be able to identify them in your lover, which will enable you to give her the foreplay and stimulation she needs to experience an orgasm. Let's discuss clitoral and vaginal orgasm, because I hear this question a lot. The difference between a clitoral and a vaginal orgasm lies in which body part is stimulated to achieve orgasm, not necessarily where you feel the orgasm. You or a partner can stimulate your clitoris in a number of different ways: by rubbing, sucking, body pressure, or using a vibrator. Although some women touch the glands of the clitoris to become aroused, for others it can be so sensitive that direct touching hurts, even with lubrication. Focusing directly on the clitoris for a long time may cause the pleasurable sensations to disappear. Your clitoris can also be stimulated during sexual intercourse, most often with the woman on top. This happens when the clitoris is rubbed against the man's pubic bone. It can also be achieved when the man is on top if the man positions himself high enough so that his pubic bone presses against his partner's clitoral area. You or your partner can also stimulate your clitoris with fingers during intercourse to help bring you to orgasm. For some women, the outer third of their vagina is also very sensitive. When stimulated during intercourse or other vaginal penetration, these women can orgasm. This would be what you referred to as a vaginal orgasm without clitoral stimulation. Orgasms are a very individualistic thing. There's no one correct pattern of sexual response. Whatever works, feels good, and makes you feel more alive and connected with your partner is what counts. Now let's focus on women having difficulty having orgasm. Both men and women can have difficulty having orgasm, although it is more common among women. For many people, becoming orgasmic takes practice. Masturbation helps people figure out what feels good and what helps them build tension toward orgasm. Levels of concentration for orgasm vary for everyone. Some find it helpful to be in the moment and focus on sensation, feelings, and intensity rather than worry about the anticipated end result. You may want to try and relax and enjoy the experience instead of concentrating too hard on reaching orgasm. This can sometimes work against you. Reducing pressure you put on yourself, taking the time, romancing yourself, and creating an atmosphere that turns you on can elevate the experience. If you think, I'll never do this, or I have to work to do this, this can also work against you. It's common for people to get annoyed or discouraged while trying to orgasm. When this happens, the trick is to take it to the next level. One way to do this is not to give up, but to continue to stimulate yourself. Think of it as if you were on a diving board. You take a running start, but when you get to the end, don't stop. Take the plunge. You may decide to take the plunge by experimenting with new sensations. People masturbate in different ways to heighten the level of sexual arousal. Some prefer using their fingers, their hands, with or without lubricant. Others masturbate with sex toys, fantasy, or erotic magazines or videos. Touching other body parts at the same time can add another dimension to pleasure. Some enjoy stimulating their nipples, anus, neck, arms, and or back. Some books that provide information about masturbation techniques and orgasm include Betty Dodson's Sex for One, The Joy of Self-Loving, Rebecca Chalker's The Clitoral Truth, The World at Your Fingertips, and my personal favorite, For Yourself by Lonnie Barbach, a great Bay Area physician. If you're still unsuccessful, consider that certain medications, drugs, or alcohol can interfere with orgasm. If after trying what I talked about, orgasm still doesn't happen, you can see your healthcare provider. If you check out okay, a sex therapist can probably help you learn to orgasm. For a referral, you can come to Student Health Services and talk to us. While learning how to orgasm may take time, practice makes perfect. In the meantime, don't forget to enjoy the trip.
Thanks, Lisa. Our second question is on a related topic. I use a clitoris vibrator a few times a week, not every day, because I can't orgasm during intercourse with my husband. Even when he massages my clitoris or me with my hand, I can't orgasm and only the vibrator can give it to me. But I am not sure if using this device on a regular basis is harmful, like using a laptop without protection on my lap. Do you know if using this device can have any effect on my fertility by having an adverse effect on making eggs or destroying them or causing any cancer over time? And is it safe during pregnancy for both the fetus and the mom?
Well, this was a very interesting question for me. At first, I want to give a broader answer, which is that the good news for all the women who masturbate out there and the people who love pleasing them, the idea that frequent and regular masturbation causes desensitization, which some people worry about, of the clitoris, preventing women from orgasming during intercourse, is false. In fact, as we covered before, masturbation only helps women increase their clitoral sensations, improving the quality of their orgasms. Many women masturbate regularly as a healthy part of their lives. Now, I did an extensive internet search and I could find nothing about masturbating with a vibrator damaging your eggs in any way or increasing your risk of cancer, so I would not worry about that. I would masturbate and vibrate away. And the other question was that, will it be harmful during pregnancy? And the answer to that is, if you have a normal, healthy pregnancy without bleeding, then orgasms are great for you. In fact, they're really great at the end of pregnancy because they can actually help bring on labor, and it's one of the most important things we recommend when people are ready to deliver. So I always say, have an orgasm. It makes your fetus smile. Have a great month. We're going to try to do these again more frequently, and Larry and I bid you adieu.